The vagus nerve is one of the most anatomically extensive structures in the human body, running from the brainstem through the chest and abdomen, innervating the heart, lungs, and gut along the way. It is the primary conduit of the parasympathetic nervous system and a central regulator of what is called the inflammatory reflex, the pathway by which the brain monitors and modulates immune activity in peripheral tissues. Its functional significance in autonomic regulation, immune homeostasis, and gut-brain communication makes it one of the most therapeutically interesting structures in human neuroscience. It is also now the target of a rapidly expanding class of medical and consumer devices that vary enormously in their evidentiary basis. Clinical vagus nerve stimulation has been FDA approved for epilepsy since the 1990s and for treatment-resistant depression since 2005. These are implantable devices surgically placed, with established efficacy profiles in specific patient populations. The therapeutic logic that modulating vagal activity can alter neural circuit dynamics in ways relevant to seizure propagation and mood regulation is well supported by mechanistic and clinical research. The more recent development is non-invasive VNS, delivered through the skin of the ear or neck, targeting the auricular branch of the vagus nerve. The GammaCore device has FDA clearance for cluster headaches and migraine with a reasonable evidence base. The physiological rationale for broader applications, stress reduction, inflammatory modulation, cognitive function, is mechanistically coherent, given the vagus nerve's role in each of these systems. And that coherence is what is driving commercial interest in bringing consumer-facing VNS devices to market. The commercial appeal is obvious. A wearable device that demonstrably reduces cortisol, lowers inflammatory markers, and improves heart rate variability in real time would command extraordinary market value in an era when biohacking and longevity optimization have become mainstream consumer interests. Several companies are already positioning non-invasive VNS devices in wellness markets with claims that reach well beyond what clinical trial data currently supports. This is where the analysis needs to be direct about the risk. The translation from a mechanistically plausible intervention with FDA clearance for specific conditions to a general wellness technology marketed for stress, cognition, and immune enhancement involves a large evidential leap. Consumer-facing wellness marketing does not require the same evidentiary standard as clinical approval, and the result is predictable. Devices will be sold on the basis of the credibility earned by clinical research. For applications that the clinical research does not yet support, the appropriate response is not to dismiss the therapeutic potential of vagal stimulation, which is real. It is to insist on a clear regulatory distinction between devices with clinical evidence for specific indications and consumer wellness products making broader claims. Without that distinction, the credibility of legitimate VNS medicine gets diluted by association with products that are essentially expensive placebo devices dressed in neurological language.